Hi, I'm Mohammed Al-Mala. We're going to do a short series about cataract surgery. We're going to talk about what cataracts are, what cataract surgery is, when you should have cataract surgery, what happens if you don't have cataract surgery, how do you choose a surgeon for surgery, what type of lenses are available for surgery. We're going to do a comprehensive review. It's not all going to be covered in one video, and so this is going to be a series of videos where we discuss these topics. So back to the question at hand, how do I know if I have a cataract? Well, before answering this question, we first have to understand what a cataract is and what a cataract isn't. A cataract is not a growth over the eye. A cataract is not something that comes over the eye. A cataract is quite simply clouding of your natural lens. In each of your eyes, you have a lens that you're born with. This lens has served you well throughout your entire life. It is focused for you at distance and near. But as time goes on, that lens can start to break down and not be quite as clear. It becomes more cloudy with time. The lens can become cloudy for a variety of reasons. It can become cloudy because of injury. It can become cloudy because of medication use. The medication that most commonly causes cataracts is steroids or chronic steroid use. Cataract can develop more quickly because of uncontrolled blood glucose for patients who have uncontrolled diabetes. But the most common type of cataracts are simply senile cataracts, cataracts that come with time, with age. As we age, the lens that was once clear starts to become cloudy. It develops opacities in certain parts of the lens. Sometimes the lens as a whole becomes cloudy. Sometimes you get focal opacities only in certain parts of the lens. In any case, any lens opacity, we call that a cataract. So why is the lens getting cloudy a problem? Well, the function of the lens is to focus light. And so if the lens is now cloudy, the light, rather than being focused to a nice, crisp focal point, is now scattered by the cloudy lens. If you can imagine, you're looking through a lens that's cloudy. So as light comes in, it's scattered by that lens, and things are no longer in focus, and things just don't look clear anymore. So what are the symptoms of cataract? You'll notice it's more difficult to see things. You may notice it's harder to see the ticker tape on TV. You may notice that you have to get closer to road signs than before. You may notice that even with your glasses on, it's hard to see a golf ball in flight. You may notice that it's hard to make out small print. If you work with numbers, you may notice it's harder to distinguish 6s from 8s. You may notice it's harder to read under dim light. You may also notice that when you drive at night, you have more glare from oncoming headlights. You may notice that when you're driving down a dark road, it's just harder to see. These are all symptoms of cataracts. However, these could also be caused by other things. And so it's important, if you're having trouble with your vision, to have an eye exam and to get dilated and to have somebody take a look at your cataracts, take a look at your macula, take a look at your optic nerve, measure your pressure, to make sure there's not other pathology or diseases that are causing your symptoms. Whenever you have an eye exam, your eye doctor should be able to tell you whether or not they feel that the cataract is the cause of your symptoms or something else is going on. If your symptoms are caused by cataracts, then you really have several options as to what to do next. One option, of course, is to have cataract surgery. And in the next video in this series, we're going to talk about what cataract surgery is, when you should have cataract surgery, and what happens if you don't have cataract surgery. Did I mention that I wrote a book about cataract surgery and what to expect before and after cataract surgery? You'll find it in the link below. See you soon.